Beyond insulin, the rise of off-label therapies for type 1 diabetes for decades, insulin has been the undisputed cornerstone of type 1 diabetes, T1D management. Because the body produces little to no insulin, replacing it is a matter of survival. However, a shifting medical landscape is seeing clinicians look beyond insulin, utilizing medications traditionally reserved for type 2 diabetes to help manage T1D more effectively. These are known as off-label treatments medications that have been FDA approved for one condition, type 2 diabetes, but are being prescribed by doctors for another, type 1 diabetes. While these drugs can offer significant benefits, they introduce a complex set of risks that require intense medical supervision. The drivers of change. Why use type 2 drugs for type 1? While T1D is an autoimmune condition rather than a metabolic one driven by insulin resistance, many patients face secondary challenges that insulin alone cannot solve. The trend toward off-label prescribing is driven by three main goals: weight management. Improved insulin delivery technology has helped people with T1D live longer, more active lives, which has led to a rise in obesity within the T1D community. Reducing insulin burden. Some drugs can make the body more sensitive to insulin, meaning patients need lower doses to achieve the same results. A1C optimization. Finding additional ways to stabilize blood sugar levels and keep them within a healthy range. GLP-1 receptor agonists, e.g. Ozempic, Mounjaro. These blockbuster drugs have revolutionized type 2 diabetes treatment by mimicking hormones that regulate appetite and blood sugar. The potential benefits: weight loss. They are highly effective at promoting satiety, helping patients manage obesity. Improved sensitivity. By making the body more responsive to insulin, they can help reduce the total daily amount of insulin required. Long-term protection. They may offer secondary benefits for heart health, blood pressure, and kidney function. The critical risks: hypoglycemia. If these drugs increase insulin sensitivity too rapidly, blood sugar can drop to dangerously low levels. Gastrointestinal distress. Nausea, vomiting, and diarrhea are common side effects. DKA risk. Dehydration from gastrointestinal issues can trigger diabetic ketoacidosis, DKA, a life-threatening complication. Metformin, a long-standing staple in type 2 diabetes care. Metformin is an affordable oral medication that helps lower glucose production in the liver. The potential benefits: insulin reduction. Studies suggest metformin can modestly lower the amount of daily insulin needed in both adolescents and adults. Blood sugar stability. It can help provide a small but meaningful reduction in A1C levels. Metabolic support. It may assist with weight management and offer potential cardiovascular benefits. The critical risks: lactic acidosis, a rare but severe side effect where lactate builds up in the blood. This is a major concern for patients with existing kidney disease. Mild hypoglycemia. While generally less severe than other drugs, it still increases the risk of low blood sugar. Digestive issues. Like many oral medications, it can cause stomach upset. SGLT2 inhibitors. These medications work by preventing the kidneys from reabsorbing glucose, essentially allowing the body to flush out excess sugar through urine. The potential benefits: glucose clearance. They are highly effective at lowering blood sugar and improving time in range. Weight loss. Clinical trials have shown significant weight reduction in overweight individuals using these drugs. Organ protection. There is evidence they may protect against heart failure and chronic kidney disease. The critical risks: euglycemic DKA. This is the most significant danger. SGLT2 inhibitors can trigger DKA even when blood sugar levels appear relatively normal, making the condition harder to detect. Infections. Because they increase sugar in the urine, there is a higher risk of urinary tract and vaginal infections. Dehydration. The diuretic effect can lead to fluid imbalances. Summary of clinical considerations: medication type, primary benefit, primary risk, GLP-1 agonists, significant weight loss and AMP. Insulin reduction, hypoglycemia, and AMP. GI distress, metformin, affordable insulin-sparing aid, lactic acidosis, especially with kidney issues. SGLT2 inhibitors effective glucose excretion and AMP. Heart protection, high risk of DKA and AMP. Urinary infections, expert note. Because of the heightened risk of hypoglycemia and ketoacidosis, these medications should never be used without strict endocrinologist supervision, and ideally, the use of a continuous glucose monitor, CGM. Conclusion: off-label medications offer a powerful new toolkit for managing the complexities of type 1 diabetes, particularly regarding weight and insulin sensitivity. However, the potential for life-threatening complications like DKA and severe hypoglycemia means these therapies must be approached with extreme caution and rigorous medical monitoring.